Autonomic nervous system. You already know have you got pen with a green color? Thank you. You already know autonomic nuclei in brain and in spinal cord. For example, in midbrain, what is the name of parasympathetic nucleus in midbrain? Nucleus accessorius. And nucleus accessorius, axons of this nucleus leaves brain through oculomotor nerve and goes to which ganglion? Ganglion, today you already prepare. Which ganglion ciliaria, and from ganglion ciliaria, postganglionic parasympathetic fibers goes to musculus sphincter pupillae and musculus ciliaris in eyeball. Then another parasympathetic nucleus in pons. Help me, what is the name? Nucleus salivatorius superior. And axons of this nucleus leaves pons through 7th cranial nerve and goes to one nerve, great epitrossal nerve, goes to ganglion pteryga palatinum, and this ganglion supplies lacrimal gland, supplies nasal cavity, and hard and soft palate. And ganglion submandibulare, that is chorda tympani, goes to ganglion submandibulare, and this ganglion supplies what? Sublingual and submandibular gland. Next parasympathetic nucleus, where? In medulla oblongata. What is it? Inferior. And this nucleus gives axons to 9th cranial nerve, and this nerve continues into tympanic, then lesser petrosal nerve, and goes to ganglion oticum. And from ganglion oticum, postganglionic fibers goes to parotid gland. Next parasympathetic nucleus we have in medulla oblongata, that is nucleus dorsalis nervi vagi, and nucleus dorsalis nervi vagi continues to vagus nerve, and vagus nerve supplies all organs on the neck. They are ramipharyngeal goes to pharynx, and here it is parasympathetic fibers finish in ganglion terminale, and postganglionic fibers supplies pharynx. Then vagus gives superior laryngeal nerve, it goes to larynx, and here it is the same ganglion terminale, and postganglionic fibers supplies larynx. Then vagus gives superior cervical cardiac branch, ramus cardiacus cervicalis superior, ramus cardiacus cervicalis inferior. Both of them goes to heart, finish in ganglion terminale, and postganglionic fibers supplies heart. Then in thoracic cage, vagus gives recurrence laryngeal, it continues into inferior laryngeal nerve, and here it is the same ganglion terminale, and postganglionic fibers supplies larynx. And cardiac thoracic branches, ramicardia, etc., they goes to ganglion terminale and supplies heart. Then rami bronchialis goes to plexus pulmonalis, here it is the same ganglion terminale and supplies lungs. Then vagus makes plexus esophagealis, and trunci vagalis, anterior and posterior trunci vagalis, goes to stomach. Here it is stomach, plexus gastricus, anterior and posterior, and from posterior plexus, rami celiaci goes to celiac plexus, and from celiac plexus, plexus hepaticus goes to liver, ganglion terminale supplies liver, plexus renalis goes to kidney, and from ganglion terminale goes to the kidney. Then superior mesenteric plexus supplies small and most part of large intestine. Splenic plexus goes to spleen and supplies it. That is all organs on the neck, in thoracic cage, and most organs in abdominal cavity. Then next parasympathetic nucleus we have in sacral department. Here it is, we have nucleus parasympathicus sacralis, and from this nucleus, here it is sacral nerves. If you remember, sacral nerves makes sacral plexus, plexus sacralis, and largest nerve of sacral plexus, that is sciatic nerve, yes. And here it is, we have parasympathetic fibers with these nerves, and parasympathetic fibers leaves sacral plexus as nervis splanchnici pelvini. Nervis splanchnici pelvini, nervi splanchnici pelvini, and this nerves goes to plexus pelvinus, plexus pelvinus, plexus pelvinus, and from plexus pelvinus continues to inner organs in true pelvis. For example, plexus uterinus goes to uterus, and here it is the same. Ganglion terminale, postganglionic fibers supplies uterus. Plexus vesicalis goes to urinary bladder. Ganglion terminale and postganglionic fibers supplies bladder. Plexus rectalis goes to rectum. The ganglion terminale and supplies rectum. They are parasympathetic innervation of all inner organs. On the head through 3rd, 7th and 9th cranial nerves, neck, thoracic cage and abdominal cavity through vagus nerve, and organs of true pelvis supplied by nervis splanchnici pelvini from sacral plexus and from nucleus parasympathicus sacralis. It is in segments from S2 to S4. And that is parasympathetic centers and parasympathetic innervation. And these nuclei, how many? 1, 2, 3, 4, 5. 5 parasympathetic nuclei makes 3 centers. First, that is mesencephalic center in midbrain. It have only one nucleus, nucleus accessorius, that is mesencephalic center. Mesencephalic center. These 3 nuclei, superior nucleus salivatoris superior, inferior, and nucleus dorsalis nervi vagi, all of them combined into next, that is bulbar center. Bulbar center, that is why bulbar, that is bulbus cerebri, that is medulla oblongata, and 2 nuclei in medulla oblongata, 1 nucleus in pons, and together they make second parasympathetic center, bulbar. And last, that is sacral center. Sacral center in segments from S2 to S4, nucleus parasympathicus sacralis. 3 parasympathetic centers we have in central nervous system, and 1 center that is sympathetic, and sympathetic center that is nucleus, help me, what is the name of nucleus? What is the name of nucleus for sympathetic nervous system? What is the name of autonomic nucleus in spinal cord, in lateral horn of gray matter? Nucleus intermedio lateralis. Nucleus intermedio lateralis. This nucleus present in segments from C8 till lumbar 3. And this center, only one sympathetic center, that is thoracolumbar center. Thoracolumbar center. That is why in central nervous system we have 3 parasympathetic centers and 1 sympathetic. And sympathetic center has nucleus intermedio lateralis in segments from C8 till lumbar 3. And look here, that is spinal cord. Look here. Maybe I take another page. Look here, that is spinal cord. This is nucleus intermedio lateralis. Nucleus intermedio lateralis from C8 till lumbar 3. And it is now we speak about this nucleus intermedio lateralis. This nucleus take place in lateral horn. This is, and that is posterior root with spinal ganglion and anterior root. And these 2 roots join together and forms spinal nerve. And spinal nerve subdivides into dorsal branch, ramus dorsalis, ramus, help me, ventralis. This is ramus communicans, what? Albus, and ramus communicans griseus. We already draw this diagram when we speak about spinal nerve. Well, ramus meningeus, the same we have, that is intervertebral foramen. And now, this nucleus intermedio lateralis, it gives axons to anterior root, then goes to trunk of the spinal nerve, then goes to ramus communicans albus, and some fibers finish in ganglion trunci-sympathice, that is ganglion of the first order, ganglion trunci-sympathice, or another name, that is paravertebral ganglion. And some fibers leaves this ganglion and goes back to spinal nerve and continues to ramus dorsalis and ramus ventralis and supplies muscles, that is human body and extremity. It supplies vessels, for example, nutrition of organs of human body, that is blood supply. They innervate human body, that is a gray communicans branch has postganglionic fibers from ganglion trunci-sympathice. Some postganglionic fibers goes to inner organs and supplies them. And some fibers pass through this ganglion without interruption, goes to ganglions of the second order. These ganglions take place in autonomic plexus, and name of this ganglion is ganglion intermedius, or another name prevertebral. First was paravertebral, and this is prevertebral ganglion. And from here, postganglionic fibers, the same goes to inner organs. And if we speak about sensory innervation, that is receptor in inner organ, and sensory fibers goes to this ganglion, then pass through ramus communicans albus, goes to posterior root, and first sensory neuron here in spinal ganglion, and that is first neuron. An axon of this first neuron goes to spinal cord and finish in nucleus intermedio lateralis, that is second neuron, preganglionic neuron, and third neuron may be in a ganglion of the first order or in ganglion of the second order. Here it is third neuron, and postganglionic fibers goes to inner organs. Now the same here. Look, that is spinal nerves, that is thoracic nerves here and here. And some nerves here. Look here. What I want to explain that these sympathetic fibers goes to anterior root, that is anterior root, trunk of the spinal nerve, and then goes to ganglions of the first order, that is trunk, and ramus communicans albus goes to ganglion of sympathetic trunk and finish here. That is the same here. Ganglion of sympathetic trunk. Here it is the same. And here, and here, and here. Now, here it is, I repeat the same, what you can see here. Anterior root, trunk of the spinal nerve, rami communicans albi, and ganglion of sympathetic trunk. Anterior root, trunk, ramus communicans albus, and ganglion of the first order, sympathetic trunk. But sympathetic trunk, the same has 3 cervical ganglions, superior, middle, and inferior. It has 4, sometimes 5 lumbar, the same number of sacral ganglions, and 1 coccygeal. And here it is the same. 1, 2, 3 cervical, 11 or 12 thoracic, 4 or 5 lumbar, the same number of sacral, and 1 coccygeal. And my question, how these ganglions, 3 cervical, lower lumbar, sacral, and coccygeal, how they receive preganglionic fibers? Here it is absent nucleus intermedio lateralis, the same like here. And these ganglions receive preganglionic fibers from upper thoracic. Some fibers goes upward, goes to inferior cervical, some of them goes to medial cervical, and another goes to superior. The same like here, lower lumbar receive preganglionic fibers from upper lumbar ganglions, because all of these ganglions join together with the help of rami interganglionaris. Rami interganglionaris. That is why, if we speak about innervation of, for example, lacrimal gland, here it is lacrimal gland. How sympathetic nervous system goes to lacrimal gland? We start from nucleus intermedio lateralis of thoracolumbar center, preganglionic fibers with anterior root, trunk of the spinal nerve, rami communicans albi, goes to upper thoracic ganglion of sympathetic trunk, and from here, through rami interganglionaris, goes to superior cervical ganglion and finished here. From this ganglion start nervus caroticus internus, and this nerve goes to internal carotid artery, and together with this artery, nervus caroticus internus, it makes plexus, plexus caroticus internus. This plexus continues into skull and makes plexus cavernosus, and plexus cavernosus makes plexus ophthalmicus, and plexus ophthalmicus gives plexus lacrimalis and supplies lacrimal gland together with the same artery. Or sympathetic innervation of nasal cavity, that is nasal cavity. We start the same from nucleus intermedio lateralis of thoracolumbar center, preganglionic fibers through anterior root, trunk of the spinal nerve, rami communicans albi, goes to superior thoracic ganglion, and then through rami interganglionaris, goes to superior cervical ganglion. From this ganglion, postganglionic fibers with nervus caroticus internus goes to plexus caroticus internus, and plexus caroticus internus gives nervus petrosus profundus. Nervus petrosus profundus joined together with nervus petrosus major and goes into the canal, canalis pterygoideus. And nervus petrosus major from 7th cranial nerve, it goes to ganglion pterygopalatinum, and nervus petrosus profundus from sympathetic nervous system. It comes without interruption, it passes through this pterygopalatine fossa and continues to nasal cavity together with parasympathetic and sensory fibers from trigeminal nerve, that is rami nasalis posterioris, and supplies nasal cavity. Or some fibers goes to nervi palatini and supplies hard and soft palate together with parasympathetic and together with sensory fibers from trigeminal nerve. That is sympathetic innervation of palate. If we speak about innervation of parotid gland or sublingual and submandibular, you should from superior cervical ganglion continues into nervus caroticus externus and plexus caroticus externus, and plexus caroticus externus goes to submandibular, sublingual gland and parotid gland through together with external carotid artery, that is nervus caroticus externus and plexus caroticus externus. If you want to answer sympathetic innervation of larynx, look here, that is a larynx, from superior cervical ganglion, postganglionic fibers goes to larynx through nervi, laryngopharyngeal nerve. And this nerve goes to larynx and supplies. And the same laryngopharyngeal nerve goes to pharynx and supplies pharynx. If we speak about sympathetic innervation of heart, superior cervical ganglion gives nervus cardiacus cervicalis superior, nervus cardiacus cervicalis superior. Ganglion cervicalis medius gives nervus cardiacus cervicalis medius, nervus cardiacus cervicalis medius. Inferior cervical ganglion gives nervus cardiacus cervicalis inferior. And thoracic, upper thoracic ganglions gives nervi cardiaci thoracici, nervi cardiaci thoracici, and supplies heart. All of them goes to heart, and heart has two plexus, superficial and deep cardiac plexus. Superficial plexus forms with the help of superior cervical cardiac nerve on the left side. All other nerves participate in deep cardiac plexus, and from both, from superficial and deep cardiac plexus, we have plexus coronarius dexter and plexus coronarius sinister, together with right and left coronary arteries, and supplies heart. Then thoracic ganglions of sympathetic trunk from fifths to ninths. From fifths to ninths, thoracic ganglions, they give splanchnic nerves. And splanchnic nerves consist of postganglionic and preganglionic fibers. Look here, that is postganglionic fibers and some preganglionic fibers. Both of them makes greater splanchnic nerve, nervus splanchnicus major. And this nerve goes to celiac plexus, and celiac plexus has ganglion celiacus, and that is this ganglion of the second order. Postganglionic fibers pass through this plexus and continues to inner organs, and preganglionic fibers finish in this ganglion, and from ganglion, postganglionic fibers goes to inner organs. That is why greater splanchnic nerve consists of preganglionic fibers and postganglionic fibers. And preganglionic finished in ganglion of the second order, ganglion intermedius. And 10s and 11s ganglions of sympathetic trunk, 10s and 11s. They gives nervus splanchnicus minor. And these nerves, the same, consist of pre- and postganglionic fibers, and preganglionic fibers goes to ganglion of the second order in celiac plexus, and after that continues to inner organs. And from lumbar nerves, lumbar ganglions of sympathetic trunk, we have nervi splanchnici lumbalis, which also goes to celiac plexus, nervi splanchnici lumbalis. All of them goes to celiac plexus, and celiac plexus has 5 ganglions. Paired, they are celiac ganglions, and paired aortorenal ganglion, and unpaired, that is superior mesenteric ganglion. 5 ganglions in celiac plexus, and from celiac plexus, plexus hepaticus goes to liver and supplies it. Plexus renalis goes to kidney and supplies it. Plexus lienalis goes to spleen. Plexus mesentericus superior goes to small intestine and most part of large intestine. That is celiac plexus. And what about sacral ganglions? Sacral ganglions of sympathetic trunk gives nervi splanchnici sacralis. They also consist of pre- and postganglionic fibers. They are nervi splanchnici sacralis. And preganglionic fibers goes to ganglion of the second order in plexus pelvinus. That is plexus pelvinus. That is the largest plexus in true pelvis. This plexus celiacus, largest plexus in abdominal cavity, and plexus pelvinus, it is plexus celiacus, and here it is plexus pulvinus. And from plexus pulvinus, postganglionic fibers goes to inner organs, uterus, urinary bladder, rectum. They receive innervation from plexus pulvinus. And you not need to draw this diagram, it is for your understanding, but reflex arc, that is sympathetic reflex arc, you need to draw the same like parasympathetic reflex arc. Look here, what is the differences? That is spinal cord, and nucleus. This nucleus parasympathicus sacralis, it present in sacral segments from S2 to S4. Here it is, in these segments, lateral horn is absent. We speak about nucleus parasympathicus sacralis in middle part of gray matter. And now, this is posterior root with ganglion, anterior root, spinal nerve, ramus dorsalis, ramus ventralis. Here it is, urinary bladder. Urinary bladder. From receptors in urinary bladder, axons goes to sacral nerves, and fast sensory neuron in spinal ganglion. From here goes to second neuron in nucleus parasympathicus sacralis, and axon of this second neuron goes to anterior root, spinal nerve, rami ventralis, and rami ventralis makes sacral plexus, that is plexus sacralis, that is somatic plexus. It is plexus sacralis, sacral plexus. From sacral plexus start nervi splanchnici pelvini, nervi splanchnici pelvini, goes to plexus pulvinus, pass through this plexus, that is plexus pulvinus, and continues to plexus vesicalis, that is plexus vesicalis, goes to bladder, and here it is ganglion terminale, and postganglionic fibers supplies urinary bladder. And now differences between parasympathetic and sympathetic reflex arc. Spinal ganglion, that is first neuron in both, in parasympathetic and in sympathetic. But second neuron in parasympathetic in nucleus parasympathicus sacralis, in sympathetic second neuron, that is nucleus intermedio lateralis. Preganglionic fibers goes to anterior root, trunk of the spinal nerve, and continues to rami ventralis. In sympathetic, goes to anterior root, trunk of the spinal nerve, and then rami communicans albi. In sympathetic nervous system, interruption in ganglion of the first order or in ganglion of the second order. This ganglion paravertebral or ganglion of sympathetic trunk. This ganglion intermedius or ganglion prevertebrale. In parasympathetic nervous system, interruption in ganglion of the third order. Here it is third neuron, ganglion of the third order, ganglion terminale. And here third neuron in ganglion of the first or ganglion of the second order. In sympathetic nervous system, short preganglionic fibers and long postganglionic fibers. In parasympathetic, long preganglionic and short postganglionic fibers, because ganglion of the third order is near of inner organ or inside of this inner organ. That is differences in reflex arc. And maybe you know that impulses in this synapse conduct with the help of mediator. In sympathetic nervous system, mediator, that is noradrenaline, in parasympathetic nervous system mediator, that is acetylcholine. And last, look here, for example, that is inner organ. It's maybe, I draw stomach, it may be liver, urinary bladder, everything, all inner organs. And I take ganglion, it's maybe this ganglion, or this ganglion, or it's maybe ganglion of the third order. It is not so important. I will draw this. This is ganglion not far from inner organ. And in this ganglion, we have motor neuron. This is motor neuron here, and here motor neuron. This is. And this motor neuron, which supplies inner organ, it has name Dodgel's cells of the first type of the Dodgel's cells. The same autonomic ganglion has Dodgel's cells of the second type. This cell is sensory neuron. From receptors in inner organ, it receives sensory stimuli. And this cell, Dodgel's cells of the second type, send impulses to another neuron. It is Dodgel's cells of the third type. And this Dodgel cell send impulses to first Dodgel cells. That is why we receive peripheral reflex arc. From receptors in inner organs, impulses goes to ganglion, and from ganglion goes back to inner organ and supplies here smooth muscles or glands, and we receive peripheral reflex arc for autonomic nervous system. In autonomic nervous system, we have central reflex arc, which pass through spinal cord or through brain, that is central reflex arc. And in autonomic nervous system, we have peripheral reflex arc with the help of three types of Dodgel's cells in autonomic ganglion. That is specific feature of autonomic nervous system. In somatic nervous system, we have only central reflex arches. But in autonomic nervous system, we have peripheral reflex arches in autonomic ganglions, because here we have three types of cells: sensory, motor, and internuncial neuron. Give me your textbook. Everybody? Nobody? Autonomic nervous system, here it is classification, central part, that is, I explain these centers, mesencephalic, bulbar, thoracolumbar, and sacral. They are segmentary centers, and they are specific. Three of them parasympathetic, and one center is sympathetic. The same in central nervous system, we have suprasegmentary centers. They are cerebellum, hypothalamus, limbic system, brain cortex. They are suprasegmentary. They are not specific. They regulate function of both parasympathetic and sympathetic. They are supra or higher centers of autonomic nervous system. Then central part, segmentary and suprasegmentary centers, then sympathetic and parasympathetic reflex arches, ganglions, first order, second order, they are sympathetic, and third order parasympathetic. Differences between somatic and autonomic nervous system, and differences between sympathetic and parasympathetic. Oh, I already explained differences between parasympathetic and sympathetic the same differences in functions. For example, parasympathetic nervous system, it supplies which muscle? Musculus, sphincter, pupilla. That is why parasympathetic nervous system, it's constrict pupil. And sympathetic nervous system, it's dilate pupil, because it supplies musculus dilatator pupilla. Heart, parasympathetic nervous system decrease heart rate, and sympathetic increase. Digestive system, parasympathetic nervous system stimulate functions of salivary glands, stimulate function of stomach, it produced gastric juice. Liver, it stimulates liver, and liver produced bile. And sympathetic nervous system, it's decrease function of digestive system. That is differences in function. Then sympathetic part of autonomic nervous system, sympathetic trunk, and you should know names of all nerves which start from sympathetic trunk. Here it is in my diagram, not all of them. Here it is a lot of branches of sympathetic trunk. And last, that is prevertebral ganglion and autonomic plexus. Here it is celiac plexus, plexus pelvinus, till here. Parasympathetic part not necessary to prepare. Only sympathetic and prevertebral ganglion and autonomic plexus. Till page 387. That is all.